Mission Brain, we often talk about neurons, vessels, and syndrome. But today, we want to talk about a morning that started normally. Yet by evening, it leaves us questioning everything. Namaste everyone. We are the medical student from Nepal. Through the Neuronotes, we try to connect neurology from textbook to real life. I am Sandeep.
Namaste, I am Rupashna, a medical student who is fascinated by the human brain and passionate about every lesson it teaches.
Namaste, I am Rahul, passionate about listening to and telling the fascinating stories the human brain tells.
And we are here today with Nima Academy and another fascinating neurosurgical case that we encounter in our clinical rotation.
We may have often encountered the phrase, time is brain, while learning about stroke in our textbooks. Recently, I came across a case that transformed this catchphrase to a powerful clinical reality. The patient was a 51-year-old male from Kavri district, nestled in the deep hills of Nepal, who was brought to the emergency department of a tertiary hospital after being found unconscious at home for an unknown duration. According to his family, he was found lying beside his bed and was immediately rushed to the hospital. On arrival, the patient was unresponsive with a Glasgow Coma Scale score of 4. His blood pressure was markedly elevated at 200 by 110 millimeters of mercury. Other vitals were stable. Neurological examination revealed fixed, dilated, and unequal pupils with more pronunciation on the left side with no response to light. Bilateral plantar reflexes were upgoing, and a strong odor of alcohol was noted. An urgent non-contrast CT scan was done, which showed a massive frontotemporoparietal intracerebral hemorrhage with intraventricular extension and a significant midline shift, a devastating picture of irreversible damage. Further history revealed that the patient had suffered a stroke several years earlier, was treated conservatively, and was advised for regular follow-up and strict blood pressure control. However, the patient was non-compliant to medical care and had not measured his blood pressure since then. He was also a chronic alcohol consumer. He was then admitted to the neurosurgery intensive care unit. But as the scans were reviewed and the clinical picture became clear, it was evident that surgery would not change the outcome. The bleed was too extensive, the damage too severe.
The treating neurosurgeons had an in-depth discussion with his family, including his 2 daughters, their husbands, his 2 sons, and his younger brother. When the news was first shared, they were devastated with shock and grief. His daughters began crying, pleading for the team to do everything possible in order to save their father. Every family member wanted some form of intervention, hoping for a miracle. Recognizing the distress, the neurosurgeons team gave them time to process the situation and returned back later for a calmer discussion. They carefully explained the severity of the hemorrhage, the irreversible neurological damage, and how aggressive interventions would only bring unnecessary pain, discomfort, and financial burden without changing the outcome. So even then, the family struggled with the decision. After a day of reflection and support, they chose a do not intubate and do not resuscitate plan, prioritizing his comfort and dignity over futile interventions. Understanding that not much could be done medically, the family chose to take him home so that he could spend his final moments in the comfort of his home, surrounded by the people he loved.
As we spoke with them prior to discharge, one of his family members quietly said, maybe if we had found him little earlier, we might have had more time with him. At that moment, the true meaning of time is brain became painfully clear.
Every minute counted, yet by the time he was found, the damage was irreversible. It made me realize how critical early recognition, quick action, and regular follow-up are, not just in theory, but in real life. One small delay can change everything, and as future clinicians, it is of utmost importance that awareness, vigilance, and prompt intervention can save brain tissue and ultimately save lives.
Moreover, this case highlighted how crucial regular screening and stroke awareness are in preventing catastrophic outcomes. Hypertension, prior stroke, and chronic alcohol use are all well known risk factors, but without routine monitoring and timely medical follow up, these risks can silently progress until a life threatening event occurs.
Simple measures like regular blood pressure monitoring, adherence to medication, and regular follow-up can make a world of difference in preventing devastating events.
In rural areas of Nepal, the importance of awareness and screening become even greater. Limited access to healthcare facilities, long travel distance, is in our case it was 2 hours. And lack of health literacy means many people only seek help when complications are already severe. By promoting community-based educations, regular screening camps, and local healthcare engagement, we can catch high-risk patients earlier, intervene sooner, and ultimately save both lives and quality of life.
This case was a powerful lesson in neurosurgery and palliative care. It highlighted that good medical practice is not just defined solely by aggressive interventions, but by the ability to recognize when treatment no longer serves the patient's best interests. Learning to communicate prognosis with honesty and empathy to support families to make difficult decisions and to prioritize comfort, dignity, and presence at the end of life are skills as vital as any procedural competence.
These experiences also reinforce the value of holistic approach to care, not just the neurological condition but also the patient's psychological comfort, social circumstances, spiritual needs, and cultural beliefs. By working closely with doctors, nurses, family members, care becomes truly patient-centered, addressing physical, emotional, and end-of-life together.
This case showed that while we may not always be able to save a life, we can always provide care. And sometimes, by guiding the patient towards a peaceful death, we can truly provide the most humane form of healing.
All in all, this case taught us far more than the neurological consequences of uncontrolled hypertension and stroke. Clinically, it reinforced the devastating and often irreversible nature of intracerebral hemorrhage, the importance of early recognition of rise intracranial pressure, and the prognostic value of timely neurological examination and imaging.
It emphasized how non-adherence to treatment and lack of follow-up in chronic diseases can progress towards catastrophic outcomes.
Most importantly, this case taught us that medicine isn't always about saving lives. The greatest gift we can give is peace, dignity, and giving the chance to say goodbye surrounded by those we love. In those moments, care becomes truly human.
Finally, it's a reminder that education, awareness, and screening, especially in rural areas, can make a big difference. As a future clinician, our duty is not just to treat, but to prevent, to educate, and provide care that truly honors the patients.
Every case we discuss reminds me of how intricate and fragile the human brain is. It is truly humbling and inspiring to see medicine in action.
A story like this shows why our works matter, not just to treat a disease, but to understand the patients, their struggles, and their lives.
Thank you for joining us on Neuronotes. We would also like to thank Nima Academy for providing us with the platform to share such fascinating stories and facilitate our learning. We hope that these cases spark your curiosity and passion for neurology and remind you that learning never stops.